morning, good afternoon, and good evening. Next year, Hong Kong will officially be called super aged, with more than 1 in 5 people being over the age of 65. The increasing demand for care for older persons and the shrinking labour supply to provide care is at the heart of the work of Dr. Vivian Lou as a scholar and an opinion leader. And we're delighted to be with Vivian today. Let me tell you a little bit more about Dr. Lou's career. She's professor at the University of Hong Kong and director of the Sao Po Centre on Aging in China. Her mission is to better conceptualise how family dynamics affect healthy aging in long-term care, toward informing the evidence base of technical, inclusive interventions for older families. Over the course of her career, Dr. Lou has sought to really understand how families, community services, commercial sectors, and even volunteers can collaborate and work together to ensure that older members of our society receive the care that they need to continue living with meaning and dignity. What was really interesting to me was that Vivian collaborates with service sector leaders, business representatives, and government committees to ensure the results of her research are translated into real-world impact. This has led to the first ever development of a carer centre action plan, partnering with community-based groups, family-orientated interventions, industrial initiatives, and a new government commitment to collect census data and build caregiver centre policies. We welcome you here today, Vivian, and thank you for being with us all the way from Hong Kong.
Thank you, Jane. Very kind words. Thank you.
So, Vivian, underpinning your work and your mission is this deep understanding of not only the demography of Hong Kong, but the interrelationship that people have with chronic diseases and the resultant level of function and the need for care. So can you talk with us about to what degree are the family caregivers imperative in the systems of care in Hong Kong?
Yeah, thank you. I think one of the very key issues in my career is how older people with frailty, with long-term care needs can be better cared in the community. So in my first 10 years of my career, and I investigated a lot on the well-being of frail older adults, social determinants, and their decision to moving into nursing home. And then I realized how important it is the family, the role of the family that has been played in supporting and made it feasible and possible for older adults who already lost a bit of their ADL, IADL functionality, but can still stay in the community. So family plays a very fundamental role in supporting the frail older adults to be very confident and also be kind of comfortable to stay in the community. And of course, as you mentioned, that we are going to move into a super aged, and then the segment for people who are aged 85 would be increased very, very fast in the coming decade of time in Hong Kong. So in this estimation, family should play more important role than now in supporting the frail older adults to live in the community and achieve aging in place.
So Vivian, WHO talks about long-term care being from services into the community all the way through to residential care. So in Hong Kong, where are the sort of the balance in terms of services? Do you see, older people, staying at home in a family setting, longer? Is that where the services, should be focused, or is it more into the residential side?
Since 2000, our government has already made very clear the policy direction is to support the aging in place. That means try to support older adults to live and stay in the community as long as possible. That is the reason that we push a lot for the government to establish a carer support policy. And also, it is very, very blessed and glad to see that last year's policy address of the Hong Kong SAR government announced that carer support become a very important element in supporting the older adults in Hong Kong.
Mm. So what do you mean by carer support? And I think it's really important to say once again, the government commitment. Now, government commitment doesn't come without a strong evidence base. So where does that evidence come from? And what does carer support actually look like in Hong Kong?
The evidence actually comes from, I think, 3 channels. The first one is since 2018, I have collaborated with multi-sectors to conduct the first ever territory-wide carer survey. And then we find out carer actually has a need on financial support, has a need on well-being support, because we found that 25% of carer living in the community suffered from high burden and depressive symptoms and poor family functioning. But among the working carers, and then there's almost 40% of them suffer from burden and family poor functioning and then depressive symptoms. This is the first source that then arises a lot of voices from the community to push the government to establish the carer support policy. And then the second one is from the census report and the census findings. And because I'm one of the advisory board members for the census department, and when we have a discussion on the 2021 census, I deliberately shared the importance to including questions on carers, and then the government actually take that into consideration and included the carers questions. And actually it has been announced very recently, and looking at the carers and the median hours a carer provided care to fair older adults is about 50 hours. So it is very high hours the families are providing. That actually create a lot of demand for the government to take into consideration on, what are the best services that we can work out. And then, of course, in the past years of time, there are a lot of organizations from grassroots, from universities, from our NGOs, all advocate that carers are really in need. And of course, we recorded some of the homicide cases in Hong Kong in the past years of time.
I'm still amazed that there's been such a strong push by government. Government often takes a long time to hear, evidence. So I think that is, very encouraging. I'm just wondering also about the sandwich. I refer them to the sandwich generation, those families that are still working, but also caring for their elderly parents. Does that figure prominently in the work in Hong Kong? How has the government recognised, the role of working caregivers in their policies?
Oh, I think this is still a kind of lag behind the caregivers group. That in our current policy, the government has a few things that has already been done or in the pipeline to do. One of the things is the government is proposed to announce a public awareness campaign in later this year, and just try to increase the public awareness on the needs of caregivers. And we all understand that many of the caregivers, they will say, oh, this is my own responsibility, so I don't want to tell people, or I don't want to seek help. So this is the first step. And then our government actually regularized the carer allowance and to support the poor families or the families have financial needs to take care of their family members, not only the older, older adults, but also people with disability. And then the government actually provide manpower resources to support the district level services sectors to provide services to caregivers in terms of skills training and the peer supported, and of course, and also other services that targeting the care recipients, including the respite care and also some kind of discharge care for people discharged from hospitals. I do believe these are all very helpful. But for the sandwich caregivers, as you are mentioned, I do believe this is one of the gaps that we have to work further to fill in. But one of the things the government is announced to do is to work out a one-stop information gateway that all the caregivers can access, so that the working caregivers, they can actually get access to the information as well as to understand the availability of the services. Not only during the office or hours, but also, because it is online, then you can access 7/24.
Mm. So the carer has an assessment of their needs, is that right?
This is something the government is also considering, but at this moment, they are going to announce, first of all, it is the information gateway. And then I'm also working on the assessment. Right. And hopefully, the assessment can be announced to the public.
Right. Okay. It sounds like that you're really at the forefront of not only the evidence, but the action, Dr. Lou. Yes. We've already, Vivian, got 3 questions coming in. So I'm going to ask you the first question on behalf of Shmuel. Shmuel is with us almost every week, and he's always out of the gate first with a question. So let me ask the question, and then I'm going to go on to the other people. Shmuel asks, what, according to you, is the role of the state and municipal authorities in the development leadership in the field of caregiving? So you talked about municipalities, the district level. So what's their role in the leadership around the development of caregiver resources?
I do believe, because caregivers usually they are taking care of a care recipients. In my context, is the older adults. So it is very difficult for them to travel for long distance to get services. So I think at the local level, it is very important if we could have a very transparent and also up-to-date information that can let the caregivers to understand what are their needs, and then what are the available services, and what are the feasible and the possible steps that they can take. And because I myself, I usually receive a lot of calls from my friends telling me, oh, my family members suffering from A and B and C, and what I can do. So I do believe that even though there are a lot of services scattered in the community, but the district level or the municipality level, if they could have some hub or leadership roles in that to actually pool all these resources into one hub, then that will be very helpful for the caregivers.
Yes, this one-stop shop is actually very important, rather than the carer going, to different places for resources, which is time consuming, and, they don't have the time. I'm going to now call on Dominic, Antonio, and then Asha to ask your questions. So Dominic, you made a statement, but I'd like you to come forward and just talk with Vivian a little bit more about your concerns.
Thanks very much. I facilitate a caregiver support group here in Pictou, Nova Scotia, and I've worked with the Alzheimer's Society. The Alzheimer's Society of Nova Scotia gets approximately half of its funding from the provincial government. the rest of it has to scrounge from one source or another. And so it seems to me that government policy should reflect a commitment to the financial well-being of such institutions, non-governmental institutions, in the work that they do. And that the other piece of this that really matters a lot is respite, that people get a chance to take a break from the stress of being with someone who can present a lot of difficulties. Time from work is one part of that. Having someone who can come in and be with your spouse, parent, whoever it is that has the dementia is another key piece. So I'm just wondering, have you been able to frame policies or suggest policies in those two key areas, please?
Thank you, thank you. You mentioned two things. One is the respite, and then another one is the home visit, like the home respite. The one is the community. Actually, in terms of the respite in the community, Hong Kong is facing a big dilemma. On the one hand, we hear a lot of voices from the grassroots, from the users, telling the government or telling our organizations that, oh, I cannot find a respite. But at the same time, our respite care services utilization is kind of not fully utilized. So these conflicting figures raise a lot of questions as an academic. I'm now going to lead a 3-year project that is going to establish care centers in 9 districts out of the 18 in Hong Kong in the coming 3 years of time. And one of my mission is to study who actually use this respite and how or to what extent this respite can really help or support the caregivers. It seems to be a kind of puzzle in this. And also I have reviewed the literatures on whether respite care is effective or not in supporting the care recipients as well as the caregivers. What I found from the literature is that it all depends on the objectives. So if the respite care is just kind of a very general respite, the effectiveness seems to be a little bit being challenged. And in terms of the home base, that means, I can have trained volunteers or care workers to visit the older adults' home, and then the caregivers can go out, and we call it home-based respite. Actually, in the past 2 years of time, I have been engaged in one of the projects that piloted in 4 districts in Hong Kong, and we recruited the experienced caregivers, or some of them maybe their care recipients just passed away, so that we train them through very rigorous training, and then we have matched them with the families. What we found is that it actually helps if the family can be matched in the way that they can trust we call it the peer supporters, because people with dementia, many of the times they are very difficult or challenged to welcome strangers. So it is very important for us to establish the trust, especially with other family members first, and then let the care recipients be familiar with that person, and eventually they can establish the relationship, and then they can deliver that kind of service. But it's not easy. And also, we didn't count the cost, because I would doubt, actually it is still very costing in terms of doing that.
And it really does require quite a lengthy time, Vivian, in the developing the trusting relationship. This doesn't happen overnight. I'd like to now invite Antonio and then Asha to make your questions. Antonio, are you with us?
Yes. Hello, everyone. Hi, Professor Lou. So you told us a lot about the role that the government is playing in Hong Kong to promote caregiving well-being, but I'm really curious to hear also what are employers doing, because they also play a important role.
This is a very good question. Actually, back to the 2019, we have already tried to promote the measures that employers can do to better support caregivers, including flexible working hours or shared work or this and that. But we still found actually under our survey, we found that a very significant portion of working adults, they would consider quit jobs because it is really very difficult for them to take a lot of leave or kind of request for flexible working hours, because in Hong Kong we have a lot of small and mid-sized companies, and then it is not easy for them to achieve that. But on the other hand, I think there has been a big move on that. And then we do have companies, including my university, actually now as an employee, I can apply for family caregiving leave. Under certain circumstances, for example, if I can show the evidence that my family members that deserve care or hospitalized or go through operation, so that I know that more and more organizations, including non-government organizations as well as private companies, they have established certain human resources measures to support caregivers. But I would say, we have to do more, and hopefully, in the coming 3 years of time, I really could push a little bit more for companies to do to actually take into consideration. I think the human resources or profession can really be if they can really join this force, that would be more powerful. Yeah.
Vivian, just a further question on the back of that, and to what degree are insurance companies now interested in supporting employees? Is there any sort of mechanisms in insurance companies? Because it seems to me that what we're trying to do is this multi-sectorial approach, isn't it, to caregiving? Have you heard of anything in that field that's going on?
I haven't. Actually, I have a few collaborations with insurance companies. What I try to share with them is a family approach. I always share with them, you have to allow the caregivers to share to bear the risks of taking care of the care recipients as the family members. So if you can have a mechanism to ensure that, so that they can actually keep their job, and also they can also share the financial risks in terms of that. But seems like, they always ask me, oh, where's the data? How I can calculate the risks, and what are the estimated pool. So I believe, the recently released census on the caregivers in among the older adults in Hong Kong might be helpful.
Yes.
But I'm not sure. Yeah.
Yes. I think this is an emerging field, but there is one field that has received a lot of attention in my time, in this whole caregiving topic. So Asha, Dr. Rao, could you come forward and share your question?
Thank you, and good evening to you. I would like to ask Professor Vivian, you are saying that you are giving training to the people, but I know that Hong Kong has got small family norm with one child. If the family caregiver is working, and then he has to come take care of the elderly person. So there comes a time when they are burnt out, and it may reflect on their caregiving quality. So during your training, do you take care of this aspect also?
Yeah, I totally agree. You know, the burnout caregivers are very, very at risk. So, based on my assessment, multidimensional assessment framework, that I try to identify layers of risks among the caregivers, and the higher risk is the suicide, homicide, and also abusive relationship. And then in the middle level is instrumental risks. That means they cannot cook meals, they cannot clean house, they cannot take shower for the care recipients. And then at the third sector of risk is psychosocial, that is depression, burnout, and this and that. So for caregivers, my approach in terms of how to support them is to stratify their needs based on these risk assessment, so that we know what their urgencies, what their real needs, and then what are the future risks. So if we can really achieve that, that will be very, very constructive. So that is my dream, to work that out in the coming 3 years of time. And hopefully that after that, we can have a very risk stratified and a responsive services delivery model. Yeah.
It's a really interesting.
Thank you very much.
Yeah, it's a very interesting approach, Vivian. Really what you're trying to understand is what the risk profile is and various archetypes, and then link that with, you know, the services and the nature in which those services are provided. So I think that's a very interesting approach. I want to just talk with you a little bit about internationally. Now, I know from reading your work that you have looked at other countries' policies. You know, to what degree does culture play a role in the development of these policies? Because the demographic landscape in Australia, for example, is quite different to that in Hong Kong, and so is the culture. So to what degree do you see culture underpinning, you know, the nature of policies?
I would say not only culture, but also the welfare regime would have an impact on the caregiver support, not only at the policy level, but also at the services and the caregiving ecology level. Give you a few examples. I think one of the example I would use is the filial responsibility. We all understand there are tons of research showing that in a culture that we treasure filial responsibility, and the caregivers are less likely to feel stressful, and they are more likely to commit themselves to taking care of family members. But in the modernization process, there are a very significant change in the especially in the Chinese context. That is the we call it new familiarism. And in this new familiarism, and the focus has been shifted from the senior generation to the younger generation. That means for any of the families, the resources are more likely to put onto the children's generation, or the young or generation, instead of the senior, the parental generation. So in that sense, there are a lot of challenges for us to figure out what, you know, if the filial responsibility becomes weaker, how we can actually support more in terms of at the policy level, at the collective level. I think this is also why our government actually take a very timely action to support the families and try to work out a more systematic policy to support families. Because previously in our Chinese culture, taking care of older adults is purely a family responsibility. But now it changes. But in Hong Kong, we also have a very special welfare regime, or you would say a policy regime, is the domestic helpers. So we do, according to the recently released caregiving statistics, among the older adults that being taken care of at home actually are around 20%. 20-something% is taken care of by the domestic helpers. It doesn't mean that the family caregivers would, it's 26%. It doesn't mean that the family caregivers would not take their responsibilities. They're still the decision maker. They're still providing financial support. They still do supervision, but the care responsibility in particular in terms of the ADL care and IADL care are shared among different groups of people. So one is kind of family caregivers or family members, and then another one could be the domestic helpers, and another sector is maybe the volunteers, as I said, the trained peer supporters, and also another sector is the formal caregiver support teams in the community. So I would say actually in our culture, in the future, it is very important to work out this ecology and also to promote the shared care culture.
And of course, ADL is activities of daily living, and IADLs are instrumental activities of daily living. I just want to ask, and just noting that Jeannie Bank has put in the chat box that, there's an international standard to provide guidance to employers, and it was based on a Canadian standard. So thank you very much, Jeannie Bank. When I was working in the field of caregivers in Australia some years ago, we talked about young carers, young caregivers. Is that notion, in the policy development in Hong Kong? Not that I agree with it, but do you talk about younger carers, those that perhaps are not of a working age? Has that been taken into consideration?
Up to now, not that concerns, but we do find that among all the caregivers who are taking care of fair older adults, about 24% of them, they aged 15 to 39. So comparatively speaking, they're young age. They have their own life course demands and developmental needs. And also they have a lot of, I would say, future and bright futures, and then their own family plan or milestones to achieve. So I would say, in the coming future, this should become one of the issues. But at this moment, we are still more focused on the old, because we're actually facing those who are oldest old, who are taking care of older adults. The recent statistics shows the oldest caregiver is kind of 100 years. You just couldn't believe. So we got the data and we find it's very surprising and amazing. The 103-year-old person is taking care of a family member. Yeah,
it's extraordinary. So Vivian, what brought you to this field of study, this interest? Is there something, what drew you to this area to begin with? Because you've done a lot of work in it, you're very much an influencer and recognized internationally, as being one of those 50, the healthy aging 50 by WHO. So what attracted you to this area of study?
On the caregiver, I would say at the very beginning, I only focus on study the social determinants of health and well-being of the fair older adults. But then I reflect on what's happening to these people. So in the very classical model, that is either you live on your own or you move into institutions. But then I found that, oh, this is not the full picture. The full picture is that you still have a comparatively long period of time that you have to stay in the community, and then who is supporting them? Then I started to study the caregivers, and I found it's a very, very complex issue. So I always share with the field that if you want to serve older adults, it takes you 100% efforts. But if you want to serve the caregivers, it will take you 200% efforts, because you are looking at both of them, at least a diet, and then you will go into a family, which is much more complicated than an individual. Yeah.
But I think also, Vivian, you've got one of those tremendous opportunities and strengths by being able to translate your evidence into narratives that government understands. And I think that's a unique talent. It's not something that every academic has. Denise Swang has got a really interesting question. Denise, could you come forward and present your question to Vivian?
Hello, Vivian. Thank you very much for your talk today. A lot of interesting information. It's always great when we can learn from different countries and global experiences, especially in Canada. We're very multicultural, so we need to understand different populations here. My question was about, are there training programs for unpaid carers in Hong Kong, like maybe for special disease focused needs, like dementia, for example? Or if they don't exist, do you think they would be well received?
Thanks, Denise.
Thanks. Yeah, we do have. I think the most popular one is kind of a training for those who are taking care of people with cognitive impairment, the dementia caregivers. Our ADA, Alzheimer's Disease Association Hong Kong, has been introduced to one. And from the international, and then they have regular courses. A lot of family caregivers, they take these courses and get the certificate, And then in our community district elderly centers, we have domain-specific training. For example, the skills to taking care of older adults, and then pain management, maybe some drug management, and also maybe some relaxation courses, but not in a very structured way. But in the past 2 years of time, in one of the projects that we tried to train the peer supporters, as I mentioned before, and our Hong Kong Association of Gerontology, which I'm also a council member of that Hong Kong AG, have developed a very structured training courses. The basic level that consists of 30 hours, 40 hours, and then the advanced level consists of 30 hours of training for the caregivers. So after the training, the caregivers all feel very, very empowered. Then they have been enhanced in the competencies to taking care of family members, and also some of them they are equipped with the competence to become a peer supporter to do the home respite. And also there's a very special one that developed in Hong Kong that is also is initiated by the government, is a course that targeting the domestic helpers. So because as I mentioned, the domestic helper is one of the very important partner in to support the family caregivers to taking care of fair older adults in Hong Kong. And our government that they actually are designed the curriculum and the targeting those domestic helpers who are taking care of fair older adults, and to teach them the knowledge and also the skills and also the communication patterns. And I myself have also engaged with some NGOs to share with the domestic helpers, especially the cultural differences. It's very interesting. When I have sharing with the domestic helpers, we found that because of these cultural differences, sometimes they feel very confused. Oh, why my host family has such demand, and why I cannot do things like this. So it is very I think essential and important for us to develop training courses, but it's not very large scale, and I would say but we do have that.
Thank you very much. Vivian, not many of us choose to be a carer. I've often said that we'll either receive care during our lifetime or we'll be a carer, and perhaps we both. Have you thought in your work about doing any work about what happens after you stop being a carer? So the person that you've been caring for, sometimes for decades, have passed away, or have you done any work in that area? And should that be part of our thinking going forward?
Oh, yeah. I do believe this is definitely one of the group of people that we should include into this carer support framework. One of the things that my colleague, Professor Amy Chow, is working on is kind of anticipated grief, and also the grief after the family members passed away. So I believe, in the coming few years of time, her team would have some significant contributions in that part. And also in one of the projects I have mentioned that we try to recruit them and empower them to become the peer supporters. This is another way. That means become a volunteer, okay, or only receive some stipends, not the full salary. But and the third way, our government is really thinking about, and also a few of our organizations are really thinking about, is how we can work out a mechanism to recognize their experiences. So that they can be credited, and then they can become a formal or paid worker in that sense. But of course, I'm also thinking about it is really very important for us to work out the re-employment or reskill training so that our caregivers, after they commit their time to family, they can rejoin the workforce. We all understand that in the super age or ultra age society, labor participation becomes very important. We should encourage every able person to continue to work. And this is somehow, we have to think way before the crisis comes.
Look, you've really opened up another topic, haven't you, about when we stop being a caregiver and what next? Because many of us who have been in that role, that almost is our identity, isn't it? And so there's the grief of loss of the identity and perhaps in the person that we've cared for. So I'm really fascinated actually how you've actually almost gone full circle in supporting these people as well. And we have a number of congratulatory comments in the chat box about that. So thank you. Antonio has another question that I think is worthy of consideration. So Antonio, would you like to come forward?
Professor Lou, you mentioned the issue of domestic workers. Here in Brazil, it's very common in the last decade to see how former domestic workers, especially women doing domestic workers in middle-class families in Brazil, are trying to make a step further in their career as becoming formal caregivers. One big issue for us is that caregiver is not a formal profession in Brazil. So there has been some movements from grassroots associations trying to establish that, to create this formal profession. But the point is, those domestic workers not necessarily have the formal training to do so. So I'd like you to dwell on that, please. How is the formal training that domestic workers receive in Hong Kong, please?
I would say we haven't had a lot of experience, but I think one of the things we can really think about is how we can establish a framework so that we point out, what are the most important things, because in Hong Kong we have this qualification framework. So our government has already established qualification framework for formal care workers. For example, if you want to be a formal employee and deliver personal care, what are kind of competencies you should be equipped, and then what training you can do. So now a group of people are working on how to crossroad this, how we can actually apply the same kind of concept to give credentials to those who are very experienced caregivers, because I think there are still a bit of the considerations we have to put, because if you're taking care of a person at home, as comparing to you taking care of a person in the institution or by pay, and then the responsibility and also the risk management is a bit different. So I think in that sense, we are not worked through that, but I know that we have organizations, and also we have some of the leaders and stakeholders. They are trying to push this to happen. Yeah.
Thank you very much, Antonio. And last question comes from Asha. Asha, you talked about some of the challenges as a domestic helper. Would you like to pose the question to Dr. Lou?
Yes, thank you, Jane. Dr. Vivian, my question is that during the old age, the victim, the care receiver becomes the victim of care abuser. They start, after some time, they get familiar with the situation of the elders, and then they start abusing their rights, their health, and they start physically, mentally, psychologically, financially abusing them. So how can it be taken care of if domestic help becomes the caregivers? In India, it happens. In India, it happens. And it happens not only by the family caregivers, but the outside care also, domestic help.
Okay, thank you, Asha. Professor Lou?
I do believe this is something we have to pay attention to. I think, as Asha, you shared, that family members could also be an abuser. But we found that, first of all, in our Chinese culture, reporting an abusive relationship is not easy. But according to my survey, there are a certain 10-20% of the family members, they are not, they reported that they don't have a very good relationship. So these families are really at risk. So I always said, for all these people who are working with supporting family members, we are trying to give them some training on the family work, how the family dynamics, and then how they change, how to identify this, And also our government has established a very clear guideline on how to report abusive relationships in the family, and how interdisciplinary conferences or meetings can be established to investigate the cases. But of course, as I said, according to our culture, we are not easy to report that. So it is very important for us to, first of all, I do believe that abusive relationship would not be established in one day. So many of the times it starts from anxiety, high burden, and then maybe some conflicts. So how we can identify these sufferings of the caregivers as well as the care recipients at the very beginning, and to prevent it to happen would be the most important mission for us. And then, of course, when we identify that, we have to have a very clear guideline on how to report and how to investigate and how to handle. Thank you.
I think, Vivian, that's why.
Thank you very much.
That's why the establishment of these carer centres are such a powerful and positive response to the needs of the carers. I'm going to ask you one last question, and it really is about, what does the future look like? So if we were to move forward 5 years, how would we know that the carer centres have been successful? What would the life of a carer in Hong Kong look like in 5 or 10 years' time, based on really, I think, very significant government policies and recognition? So how do you see the future looking?
I would say, if my dream is after a decade, all the carers, they really be aware that they are carers first, and then as a carer, they are at higher risk as compared to a non-carer to suffer from poor physical health, psychological distress. So they have to be very cautious on that. So when they really have needs, they have to seek help. And then the next thing is, all the carers, they can visit our website and do a self-assessment. That means they are really do self-care by start from monitoring, whether I have some issues to take care of myself, to take some rest, and then to seek help from professionals. This is the second thing. And the third thing is that our services can be really stratified and responsive. So we're not saying that every carer has certain needs or has same needs, definitely not. But how we can establish a service delivery model, a support model, so that we can identify their needs, and then the services can be very responsive and targeting their needs. And this is my dream.
Good. All right. Well, we'll hold you to that. So I'm going to pause for a minute, and we're going to just move for a couple of minutes to announce the next week's speaker. So I'm looking forward to that. Before that, I would just want to recognise the text. No, you can leave it there, Luana, that's great. I just want to recognise the comment from Denise Zhuang in the chat box. I think it's very important, and Denise, I'm going to read it out. Especially during the pandemic, there was an attitude that PSWs were sometimes at fault for the spread of COVID. And since many of our care workers are immigrants to Canada, other social factors came into play with this negative attitude. It is a very important comment to make, and I thank you, Denise. And no one was at fault. This is a powerful, powerful infectious disease. It has canvassed the whole world. We are still, within the pandemic, and everybody contributes to the solutions to protect one another. But I do thank you, Denise, for your comment, because you're quite correct. It's easy, to register blame and fault, and that was not it. So thank you for that. Next week, we will have the great pleasure of being in conversation with Helena Herclocks, who is the Older People's Commissioner for Wales. And she'll be talking about tackling ageing and making communities more age-friendly in Wales. So join us next week, Friday, March the 10th at 7 a.m. And before I hand the floor back to you, Vivian, I just want to acknowledge the IFA staff who always put these global cafes together with professionalism and with grace. particularly Ashni, Patrick, Luana Kognagi, and I've got your name wrong, Kolnago, thank you, and also the IFA team that sits behind them. I also want to acknowledge the International Vice President of the IFA, Grace Chan. Grace has been with us this morning, but Grace, you're not only a wonderful colleague and a powerful member of the board, but a wonderful friend of many, many years. So thank you for joining with us today. Vivian, I give you back the floor for your takeaway messages to everybody at this Global Cafe.
Oh, thank you. Thank you, Jane. And also thanks for all the colleagues and who make this happen, and very honored to share with all of you, and also very insightful questions. I think that there's three takeaways. The first thing is, as Jane, you have shared, caregiver matters to everyone. You know, we can be a past caregiver, current caregiver, future caregiver. So it matters to everyone. And then the second message is caregiver plays a significant role supporting the healthy aging in a super aged Hong Kong, and I believe globally it is the same. So we have to give them full recognition, and also we have to increase the awareness of the public on the role of caregiving in the family, in the workplace, and also in the community, in our society. And the third and the most important takeaway is caregivers are very diverse. They age from 15 to 103, so that, you know, there's no one solution. So stratified responsive delivery model is very important for us to develop and also to achieve a shared care ecology, so that not only the caregivers, but also the care recipients, our fair older adults, can stay in the community and achieve optimal trajectory of care in their life, and with dignity and well-being. Thank you.
Yeah, look, thank you very much, Vivian. We've had the great honour and pleasure to be listening and to be in conversation with you today. There is no question that your leadership in the field of caregiving, health and well-being not only sits in Hong Kong, SAR, it is world. And so we thank you for your time and your energy, and also your commitment to this field. Most importantly, your ability to translate evidence into narratives that are meaningful to government. And that's how we actually build the understanding of the needs of carers and develop service models to respond to those needs. So thank you very much. I know it's 9 p.m. in Hong Kong, and it's your time, and it's Friday night. So I hope you have a wonderful weekend. Thank you to everybody else. Stay safe and well, and we'll see you all next week. Thanks very much, Dr.
Thank you. Thank you.